Is saliva a good diagnostic tool for the detection of COVID-19? We all know the saliva plays a major role in the transmission of COVID-19 through droplets. So you may ask why we should collect saliva, why not any other samples? The saliva is convenient, non-invasive because it doesn't need any punctures, and it can be collected by the patient, reducing the contact with the healthcare professionals, reducing the risk of them. And also, in cases of dry cough, we can take saliva. Researchers have told that the secretions from the nasopharyngeal tract, the SARS-CoV-2 is equivalently expressed in the saliva too. It is expressed even till the 11th day of hospitalization of the patient. So, knowing the structure and pathogenesis of SARS-CoV-2 in the previous video, we can move to this portion of video. You will understand it if you would have seen that portion of COVID-19 basics. So the salivary gland, oral mucosa, gingiva, tongue expresses the ACE2 receptor, which is responsible for the attachment to the spike protein of the SARS-CoV-2. And also the activation and the priming will be done by the furin and the serine proteases respectively, which is very much important for the pathogenesis of COVID-19. So this salivary gland acts as a target for the SARS-CoV-2. So where does this origin of SARS-CoV-2 in saliva comes from? Either from the salivary gland via the duct, or from the GCF in the gingiva, or from the lower and upper respiratory tract secretion that combines with the saliva. And also, why there are some cases are asymptomatic, we can justify with the saliva. Like if the point of entry of SARS-CoV-2 is the salivary gland, and this virus is just contained and proliferated in the salivary gland itself without even progressing into the respiratory tract, that may be the reason for the asymptomatic cases. So this should be, in the future studies, should be studied with the ductal saliva and not with the whole saliva. So the ductal saliva of the parotid gland can be collected by the modified Carlson cretin cup and Ashley's cup, and also from the submandibular and sublingual gland by the saliva collectors. So in cases of recurrent cases, how can we justify salivary gland if it is a target? Then reservoir, it acts as a reservoir. So some reactivation can occur for the recurrence of COVID-19 if the salivary gland is the target primary entry point of SARS-CoV-2. The future studies should be done in GCF, so that the GCF would be a diagnostics tool as that of the saliva. So usually GCF has been used in various diseases like herpes simplex virus, Epstein-Barr virus, cytomegalovirus, with an absorbent point for the collection of GCF. So it is also non-invasive. So we have to know whether GCF, since the gingiva also expresses the ACE2 receptor, may be a point of entry for SARS-CoV-2 cause COVID-19. And also saliva can analyze various stages of COVID-19 from the course, progress, prognosis, or if there is any antibodies which is produced by the host of so these are the further exploration needed to be done with further research. So this is the overall view, so that the saliva is a good diagnostic tool in the diagnosis of COVID-19. Thank you.